Dr. D. Gay, thank you so much for being with us. You're an endovascular and cerebrovascular neurosurgeon with Methodist Hospital. And today I feel this topic is very important for our audience to really listen to themselves when it comes to strokes. What causes a stroke and who is at risk for one?
So let's use an analogy, right? If you're to think of the brain as this highly active engine and its oxygen and nutrients to work.
Sure.
And you can think of blood vessels as pipes that connect the heart to the brain. So stroke happens when an area of the brain that needs blood and oxygen doesn't get it and the tissue dies, right? So there are two types of strokes. There are the ischemic strokes, which happen 87% of the time. This is when the pipes get clogged. The other type, a hemorrhagic stroke, which occurs about 13% of the time, is when the vessel ruptures. Now, in terms of how common are strokes, I mean, it's the 5th leading cause of death in the US. In San Antonio, it's probably the 4th leading cause of death. People have to be aware of, it's not just a disease of the elderly, right? We're seeing more patients within the 18 to 64 age that are having strokes now. The leading cause, one, is hypertension, so high blood pressure. So working with your primary care doctor to reduce your blood, to make sure your blood pressure is under good control. That reduces your risk of stroke. Smoking. So smoking is another leading cause of strokes, and so quitting smoking can make a huge difference in reducing your risk. High glucoses, so that poorly controlled diabetes, high cholesterol. These are all things that can damage the blood vessel walls and cause a stroke. And finally, obesity and inactivity. So these are things that if we modify, say moderate activity, brisk walking 20 to 21 minutes a day, can go a long way towards improving cardiovascular health and reducing the risk of stroke.
Well, those very helpful information there. As far as people may be worried right now, is there anything they can do to learn more?
Yes, so I think in terms of going to the AHA website or the CDC websites, they'll usually have the guidelines. But now if someone is having a stroke, I think the most important thing to remember from this talk is FAST. So F-A-S-T. So imagine you're at dinner and your family member suddenly you notice drooping of their face or weakness in their arm, they're unable to feed themselves, or slurring their words. Just remember it's time to call 911. So F for face, A for arms, S for speech, and T for time. Because the sooner you call 911, the EMS participants can get there and start providing life-saving care to your family member.
Well, thank you so much, Doctor, for being with us today. This all has been very important, knowledgeable information you shared with our audience. We appreciate your time.
No problem. Thank you.